Hello, I'm Paulina Riojas with the Mako Media Network Health Update. I'm here with Dr. Arti Raja, a professor at NSU's Homos College of Arts and Sciences. She earned her doctorate in microbiology at the University of Maryland and completed her postdoctorate work at Harvard Medical School. Her areas of research include microbiology and innovations in science education. Dr. Raja has several years of research in the field of virology, specifically HIV and its protein. In addition to research and teaching, she gained vast experience in the field of infectious disease, consulting for the pharmaceutical and financial industries. Welcome, Dr. Raja.
Thank you, Paulina, for having me. It's a pleasure to be here.
What is POTS?
Sure. So POTS actually stands for postural tachycardia syndrome. So this is a syndrome or a disease condition that some patients have following either having been infected with the virus or in some cases just as a condition by itself, following other complications that they may have had.
What are some common symptoms of POTS?
Sure. So POTS, the most common symptoms are things to do with the heart. So you would see an increased heart rate. So normally heart rate is around 72 beats per minute, but in someone who suffers from POTS, it can go up to 160 beats per minute. Another very common symptom, is fatigue, dizziness, headache, and again, the idea that it's called POTS, so it's postural tachycardia, so postural, something to do with your posture. So basically these patients, the symptoms they'll have is when they suddenly get up from a sitting position, they'll get really lightheaded and dizzy, and they may faint even, or they'd have difficulty lying down. Research has shown that a lot of people, because of these symptoms that they suffer, they are unable to continue with their work and they've had to stop working, which becomes a big issue for them.
What was POTS like before COVID-19 compared to now?
So the name POTS itself was assigned only relatively recently in the last few years. And following COVID-19, what they have noticed is there has been an increase in the number of patients who kind of talked about certain symptoms that they're experiencing following having had COVID-19. And finally, people have started learning to diagnose it, and they're beginning to characterize it as being POTS.
There's been a surge of young women diagnosed with POTS. What are some treatments?
Sure. So the current treatment that most people rely on is primarily physical therapy. So they would get some exercise for their legs, for their limbs, basically, their legs and their arms, so that they're able to sit or stand in a particular position for extended periods of time. They're also going to suggest that they have more of a salt intake into their system so that there's better fluid balance and they don't feel that lightheadedness or giddiness. So those are some of the very basic quick treatment options. There are some other treatments that are available if it gets even more serious, and those medications will be similar to those medications that people would take if they have some kind of heart complications. There isn't one medication right now that you can just take and completely get rid of all your symptoms. That is the unfortunate part of the syndrome.
Thank you. Do you have any last thoughts about POTS?
My only thoughts are it is an unfortunate condition that has popped up following COVID-19, but if there's any silver lining, so to speak, if at all that can be said in that manner, it is at least it's brought the condition out to light, and hopefully more people will be thinking about it, and there will be more physicians who are trained to diagnose this condition and help the people who are affected by it.
Thank you, Dr. Raja, for being here with us.
Thank you. It was my pleasure.
This has been the Mako Media Network Health Update. See you next time.